Welcome, everybody. Thanks so much for taking time to join us. We'll give people a few minutes to log in and we will get started soon. But if you are looking for the webinar for Introduction to Radon for Alberta Municipalities, you're in the right spot. And yeah, thanks for joining us today. All right. Looks like we've got a good group that are logging in. We are really glad that you're joining us. The benefit of being live on the session today is that you can ask your questions today as we go through. And so we really encourage that as questions come up, even if we're still in the process of doing presentation, feel free to use the Q&A and put them in there. We also have opened up the chat, so feel free to chat in, let us know where you're joining us from. I don't know, something Canadian like the weather, or let us know how things are going for you. But we really are thankful that you're joining us today. We love to connect with people all over the country, but it's really great. We've got a good group here from Alberta. So I'll introduce you to some of your neighbors around the province, and then we'll get started with our presentation. So Caitlin Penstone is with Health Canada. Caitlin, I'll get you just to introduce yourself, let them know your title and background before we get started.
Hi, everybody. As Pam had said, my name is Caitlin Penstone. I work with the National Radon Program, which is typically in Ottawa, which is where most of my team is, but I'm just outside of Edmonton, as this is home for me, and I ended up moving back just before the pandemic. I am the policy analyst for the National Radon Program, and I typically handle most of our digital communications, both on the web and as well as physical communications, so development of postcards, as well as the Radon Action Guides that we created for municipalities and for provinces and territories.
Perfect. Thanks, Caitlin. And Madison, with Health Canada, if you want to introduce yourself.
Yeah, hi, my name is Madison. I'm the regional radiation specialist for Alberta and then also the Northern Territories. So I work with Caitlin's team in Ottawa, and we kind of work together on the National Radon Program.
Perfect. And Jamie, do you want to introduce yourself?
Hi, everyone. My name is Jamie Happy. I am the Health Promotion Coordinator at Alberta Lung. My role sees me managing and creating content for educational programs, patient support, as well as patient support group programs, as well as running the Radon program at Alberta Lung. I'm based in Edmonton, and my background is in sociopolicy as well as healthcare research. Thanks, Pam.
Yeah, perfect. Thanks so much, Jamie. And we also have Erin Curry with Take Action on Radon. She's joining us as part of our tech support. So she'll make sure we get all the questions that you put into the chat or into the QA as well, and help us with any of the tech issues. All right, and my name is Pam Workington. I'm the Executive Director of CARST and CNRPP, which is our national association and certification program for radon, and also project manager of the Take Action on Radon program. And I am coming from Winnipeg, so just a few provinces over. Really glad to be able to connect with you today virtually. So we will start today by talking a little bit about some basics of radon, but really we want to answer some of the questions that we found that a lot of the municipalities that we've been just talking to and reaching out to have had. So some of the questions we will answer today is things like the cost involved in testing, costs of mitigation, are there trained certified professionals, who are they, and how can the citizens in your community access them? And then also some of the questions we get is, why are we talking to municipalities about something that's a health issue? And so we hope to answer those questions for you. And as part of that, Health Canada has developed some Radon Action Guides. So Caitlin's going to walk us through those and help share some specific resources that have been developed for municipalities. And Take Action on Radon is proud to unite members from across Canada, which encompass the traditional territory of many First Nation, Métis people, and Inuits whose ancestral footsteps and rights extend beyond our colonial boundaries today. And we respectfully honor these people's rights, history, and relationships with our land. And we are very grateful for the resources from across the country. All right, so I mentioned we have done municipal surveys in Alberta. And so we asked a couple really simple questions. One was, are you aware of radon? And so we actually were, I was surprised that all of the municipalities that answered yes, they were aware of radon. But one of the gaps was when we said, you know, did you know that Health Canada has developed these action guides? No, there is a lot of people that didn't know that they were available. So that really helped inspire us to say, well, let's help you find them and get them more accessible for you. Another question we asked was about considering implementing a public awareness initiative. And so there was a really great interest in it, but a lot of questions for, you know, where are resources and those sorts of things. And so that too helped us with saying, okay, a webinar would really help us with answering those questions. And then another interesting question was about municipal testing. So have you, as a municipality, tested your buildings for radon? And so 63% said no, 25% were really interested in testing. Or sorry, 63 were really interested in testing. Some were not, but we did have 13% that did test in the last year. So that was really great. So I'm going to hand it over to Madison, and she's going to give us a start with the basics of radon.
Yeah, awesome. Thanks, Pam. So I'll start with what is radon. So radon is a radioactive gas that is produced naturally by the breakdown of uranium in soil and rock in the ground. So one thing about radon is it's colorless, odorless, and tasteless. So the only way you know if you have radon is to test. So that's why we encourage everyone to test. Next slide, Pam. So there is natural radiation everywhere. There's four major sources of public exposure to natural radiation. So that includes cosmic radiation, terrestrial radiation, inhalation, and ingestion. And then there's four categories of artificial sources of radiation. So that includes atmospheric testing, medical sources, industrial sources, and things like power plants. And out of all of these different sources of radiation that we're exposed to during our lifetime, it's estimated that radon represents almost 50% of this. So that's why it's important to know about. So next we'll go into what the Canadian guideline is for radon. So Health Canada recommends mitigation in any areas that are over 200 becquerels per cubic meter in areas that we spend more than 4 hours per day. You can go to the next slide. So here you can see the radon map of Canada. It's the radon risk map. This was developed using radon data from the Health Canada Cross Canada residential surveys over the past 10 years. And it is estimated that approximately 7% of homes in Canada have high radon. And as you can see, there are no areas of the country that are radon free. And there's radon in every building, and you can see Alberta on the map there, so it varies across the province. And one really interesting thing is that two houses that are built side by side can have different levels of radon. So just because your neighbor tested and they were low doesn't mean that you're also low. You have to test your own home to know if you have a high level or not. Next slide. So radon is found in all buildings. So you can see it's found in residential homes, workplaces and offices, schools and daycares, and other buildings. But the thing is that the biggest risk exposure for radon is at home, because this is where we're spending most of our time. Canadian statistics show that most Canadians spend around 70% of their time indoors at home, about 20% of their time indoors away from home, and then 10% of time indoors. So it's very important to test your home. Next slide. Now we'll talk about how does radon get into a home. So it can enter a house through any cracks or openings or gaps in the foundation, walls, or floors. And then the air pressure inside of a house is normally lower than the pressure underneath or around the foundation. And this difference in pressure can act like a vacuum, which can draw radon in through different cracks and other openings. And once the radon is inside of the home, it can build up to dangerous levels. So as I said earlier, Health Canada's action level is at 200 becquerels per cubic meter. Anything higher, we recommend mitigation. Next slide. So we've been talking about radon and what are the health risks of radon. So radon is the #1 cause of lung cancer in non-smokers, and it kills more than 3,000 Canadians each year. Go to the next slide. So kind of building on that, this is a radon exposure risk comparison chart. So I think it shows the prevalence of radon-induced lung cancer deaths versus more common or more things that we think of more commonly that people can pass away from. So things like car accidents, carbon monoxide, and house fires. So as you can see from the chart, that the amount of radon-induced lung cancer deaths are more than all 3 of these combined. So while the risk of lung cancer from radon is significant, it is preventable. Go to the next slide. Now I'll talk about testing. So how can you test for radon? There's 2 different options. You can buy a do-it-yourself test kit or hire a radon measurement professional. One important thing to know about testing is that buildings should be tested using a long-term test kit. So that means at least 3 months. And Health Canada also recommends to test during the fall or the winter months. So this is a perfect time to start testing or start thinking about purchasing a test kit to do a test. Go to the next slide. So as I said before, we recommend that 3-month test. So as you can see from the chart on the slide, radon levels can vary greatly, even over a short amount of time. So having a long-term test, it gathers more data and it gives you a better estimate of what your annual average exposure is. And many different things can influence your radon levels over that time. So as you can see on the screen, things like building design, building condition, and occupancy patterns, even opening windows. So it's better to do a long-term test. And we'll go to the next slide. So when to reduce your radon levels. So if you do a radon test kit and it comes back and it's over that 200, but it's between 200 and 600, we recommend to get your home mitigated within 2 years. And if it's above that 600, we recommend to get your home mitigated within a year. And I've been talking a lot about mitigation, so we'll go over what mitigation is. So it can also be called active soil depressurization. Or active subslab depressurization. This is the most common and effective and reliable technique to get rid of radon. So basically a pipe is installed to the foundation and it's directed outside. So a fan will be attached to the pipe and it's continuously running and it draws the radon out and it gets vented outside. And once radon mixes with the air outside, it's diluted to low levels. So with that, the active soil depressurization systems can often reduce the radon levels by up to 90%. The cost is typically between $2,000 and $3,000, and Health Canada does recommend to use a certified professional for radon mitigation. So you can find that at cnrpp.ca. So that stands for the Canadian National Radon Proficiency Program, and I'll hand it off to Pam to speak more about that.
Great. Yeah, so often once someone tests for radon and they receive that high level, as Madison said, they can determine whether or not they need to take action. And the good news is that there are ways to reduce the radon levels, and there are certified professionals around the province that can help homeowners with reducing this. And so Madison talked about the mitigation system. Another thing to note is that it is simple and easy to maintain. So once it's installed in a home, it now reduces the radon levels for the life or for all future occupants in that home. Another thing that is important to note is there is radon control measures as part of the National Building Code. And so the National Building Code includes gravel layer under the slab, a well-sealed liner, and then a sealed sump pit. And it also includes a radon rough-in for future use. And so this is a 12-inch pipe that sticks up out of the ground, and it is capped and sealed And then it also has a label on it. And this pipe is not fixing the radon at all. It is just a start to that mitigation system. So Madison talked about the up and sidewall discharge or up and through the roof. The radon mitigation system would be installed in existing homes. And in new homes, the pipe just is the start of it. So this pipe now would be extended up and out if a home was tested and had elevated radon, and then now they can mitigate to reduce the radon levels. And so if any home that has this still does need to be tested. All right, I'm going to hand it off to Jamie, and she's going to talk about some of the Alberta lung programs.
Thanks, Pam. So like she mentioned, I am from Alberta Lung. Alberta Lung raises awareness about radon and encourages radon testing through our library rental program. It's currently active in most library systems. It serves roughly 250 libraries across the province, and we also have an interlibrary system. So libraries that may not have a kit can also access a kit through another library. Generally speaking, you can check out a kit for about 3 weeks at a time for a snapshot into your radon level. So this is a good indicator. We do encourage patrons to follow up with a full long-term test in 90 days, ideally during winter, to get an accurate reading. The kits are free. So you can now talk to your local library to see if they offer the kits. You can also contact us to see if we can help find a library system in your area that can offer a kit. In addition to that, we have our radon testing guide. So this is a video walkthrough of how to use your kit once you purchase it. And we use a screening form afterwards to get interest on what radon levels are like across the province, what the process is, and concerns are for people who are testing their homes for radon, as well as getting a snapshot of what general radon levels are like across the province. Okay, next slide. Okay, so once patrons are ready to purchase their kit, they can purchase it at homeradon.ca, which is a partnership between Lung Sask, Alberta Lung, and a laboratory in Saskatchewan that specializes in radon testing. Madison will go into this a bit more, but there are discount codes for patrons that do rent out the kit at the libraries so they can purchase a kit afterwards. All right, and I will hand it over to Madison.
Yeah, so
Thanks.
just continuing on the library program, we did do a pilot this year where libraries that are participating in Alberta in the radon lending program, you guys can get posters and bookmarks. So the bookmark is on the far left, and then in the middle is the poster, and then this is the discount code that this is the discount code on the right hand side that can go in. We haven't had much interest from Alberta libraries, but if you do know anyone that works in the library system, or if you're part of it, please let me know and I can send you these materials because we're really trying to encourage people to follow up the short-term test that you get with the library rental with doing a long-term test kit. Go to the next.
Right, and then now we've talked about mitigation. Another thing that homeowners often ask is, are there any grant programs available across the country to help with the cost of mitigation? And so the Canadian Lung Association has developed a new grant. It's called the Lung Matters Grant for Mitigation Systems, and it is available for people across the country. The criteria are they must first have tested for using a long-term test. And so those would be the devices that they purchase, such as the one Jamie talked about through the Alberta Lung program, the Home Radon Test program. Those are Alpha Track one-use detectors, and they provide a report. So they can, they'll get that by email. They can upload that as part of the application. They also need a quote from a CNRPP certified professional. So they do need to apply prior to doing any of the mitigation work. And then it also, they need a qualifier. So the grant is for anyone who has lung cancer or an occupant with lung cancer, or for anybody who's in a low to moderate income bracket. And so they do need to submit some information on income as well.
So I'll jump in here, and I'm sure as everybody as that's a part of this presentation works for a municipality in some way, shape, or form, we get a lot of questions about why Health Canada doesn't just fix the problem, pass policy and legislation to be able to deal with radon. And that is because radon is a multi-jurisdictional issue. So to enable radon reduction behavior in Canada, we need the help of other levels of government to engage and develop radon action plans and programs in their jurisdictions. Health Canada's National Radon Program's mandate is education and awareness. So we have developed 2 Radon Action Guides, one for provinces and territories and one for municipalities. These guides describe why radon action is important. It includes evidence and rationale for radon action, and it makes it easy as possible for jurisdictional authorities across Canada to start incorporating radon into their programs and policies. So these guides are evidence-based. They were written in collaboration with a practicing lawyer who also holds a PhD in human geography, with research completed in sustainability and built environment and radon exposure law and policy. Next slide. So radon action fits with widely accepted goals and other objectives of public health, consumer protection, and environmental governance. Canadians look to their governments to ensure health needs are met, and that action on radon is a way to help people avoid unnecessary risk and save lives. In addition to the Radon Action Guides, which we also refer to as RAGs, we developed 2 supporting documents which are of particular interest to municipalities. So one is entitled Justifications and Policy Rationales for Radon Action. This explores details the ethical, legal, and jurisdictional justification for radon action. And radon action in municipal law analyzes municipal law principles to show how municipalities have legal action to take action on radon. The risk from exposure to radon can be much higher than Canadians, except from other known hazards, as Madison discussed earlier. Radon-induced lung cancer is a number 1 cause of lung cancer for non-smokers, and it's linked to over 3,000 deaths every year. Provinces, territories, and municipalities' regulations, policies, and outreach programs on these issues have led to important behavior change, such as wearing seatbelts and installing smoke and CO detectors in home, which have resulted in significant decrease in deaths. We are hoping that these radon action guides, we can work with municipalities and provinces and territories to make similar progress in reducing radon-induced lung cancer. Next slide. So there's clear justification and policy rationale for incorporating radon action into the work done by provinces and territories and municipalities. As you can see on the slide, there are many themes or areas where you have the authority and should consider the inclusion of radon in your policies and programs, such as environment and sustainability, climate action, public health, air quality. The Radon Action Guides includes evidence, guidance, and many examples on how radon can and should be considered in all of these areas. Next slide. So speaking specifically to the Radon Action Guides for municipalities, it looks at municipal law principles to show how municipalities have legal powers to take action on radon, and also provides guidance and detailed examples of many actions that municipalities and local governments can take independently or in concert with higher levels of government, such as public education programs, community testing and radon risk maps, testing and mitigation in schools, daycares, and public buildings, and including radon in standards of maintenance and business bylaws. Radon can be incorporated into many of the municipal policy platforms and priorities, such as sustainable planning, housing policies, healthy community strategies, and indoor air or clean air bylaws. Next slide. So as part of the National Radon Program's education and awareness. Every year we send out a number of postcards to Canadians all across Canada. In previous years, you may have seen our other iteration of our radon postcard, citing that radon gases in your home and encouraging Canadians to take action to test their homes. We sent out approximately 1.5 million postcards every year for a total of 3 years. And we have now actually started back at the top of our list, which basically shows the areas in Canada where there are the highest percentage of homes that have tested for radon with radon levels above 200 becquerels. So this November, the postcards were actually delivered approximately between last week and this week. You can see on the slide that we had a number of postcards going out to Manitoba, Saskatchewan, Ontario, Quebec, Newfoundland, Nova Scotia, New Brunswick, BC, and Alberta. We will be sending out a second postcard in January that will be moving further down the list. And this is a method that we're using to increase education and awareness and encourage testing by Canadians. And I think that's all from me, Pam.
Great. Thanks so much, Caitlin. And we also wanted to point out that there are some resources that are already developed to help municipalities and libraries and different organizations to be able to share information out. And so Health Canada has various resources. This is just kind of a snapshot of some of them. And Madison and Caitlin did show some of the other ones on the screen as well during their presentation. But we will provide you a follow-up email after this webinar with links to a number of the points, the Radon Action Guides, and some of the resources that are easily available. So Health Canada has some resources as well. Take Action on Radon also has some resources, and so we'll give you a link to the order form so that you can also access those. Some other resources that we thought you may want to be interested in knowing about is the White Ribbon Campaign. This is a project that provides free test kits to anyone who has lung cancer in their family member. So as you hear of somebody that may be wanting to test for radon, you can certainly direct them to this program, and we can help them access a free kit. Another program that we have for communities, for municipalities, is called the 100 Test Kit Challenge program. This is a program that's been running over the last 5 years. We've been able to distribute test kits to over 120 communities from coast to coast, including communities in Alberta. The program is a turnkey program, so it provides all the resources, including 100 free test kits that you can hand out to citizens. The concept of testing for radon is, or the process for testing for radon, you put the detector in place, leave it for 3 months, and then you have to mail it back to the lab. So the 100 Test Kit Challenge program provides free shipping to the lab. So participants would come to a local location within your community, pick up their test kit package, and then there would be a collection period where they'd be able to drop it off. And so that would help with the cost of shipping. It also creates a community feel to the testing program so that they don't feel like they're on their own, that they can know that their neighbors are also testing, and so they also can engage and talk with each other about the fact that they're all testing for radon. And so in the last 5 years, we have done some communities in Alberta, Spruce Grove, as well as Sundre and Black Diamond. And at the end of the program, we provide a community report. So those community reports can be found on our Take Action on Radon website. And I just put a quick summary of the results here. So for Spruce Grove, Sundre and Black Diamond, the percentage of homes that tested above guideline are listed here. And you can see more details in the report when you go to the Take Action website. And this year we are all working with Lacombe County, Edmonton, a group in Edmonton, and then also Innisfail to distribute test kits. So those projects are, Edmonton is in process, and then Lacombe County and Innisfail will be kicking off in the next week or so. All right, so that is the presentation. We did have a few questions that were submitted, so I'll start with those questions first, and then we will open it up. So if you have any questions, feel free to put them in the Q&A in the chat Madison, I am going to start through a question to you first. Are there any, you talked about the fact that radon was connected to lung cancer, but are there any other risks other than lung cancer?
No, the only known health effect from radon is lung cancer.
Right. Okay, good. Thanks, Madison. Jamie, one of the questions we had also was both where to get a kit and how much. And so I know you talked about it during your presentation, but maybe I'll just get you to give another recap on those.
For sure. I'll answer the library question first. Interested libraries can contact us at info@ablung.ca. Alternatively, they can also go to our website, ablung.ca, to get more information on working on a program for their library or library system. Usually how it goes is they will contact me with interest. They'll let me know how many patrons they usually see. And if their community seems open to having a program, we will organize a drop-off of kits, educational materials, as well as social media and posting and press releases. And then in November, we'll launch it with the program. And we will check in with the library regularly and encourage them to have their patrons give feedback through that form. If anyone has questions about that, again, they can contact me at info@ablung.ca. The program does usually start in November, but we can always discuss onboarding them to the program next year, or alternatively finding a nearby system that can loan them out to that other system or library branch. A kit does vary when it comes to cost. I'm just going to use homeradon.test.ca as an example. We have a reduced cost kit on there that is a single day, 90-day test for $65. A continuous radon monitor also is an option. It's a test kit that is not single use. You would not need to mail it in, but you would still need to do the test for 90 days to get an accurate reading. However, it tends to be much more expensive. I have seen ones that are anywhere from $125 all the way up to $300. So which is why we offer the cheaper single-use 90-day test, as well as it's a good way to get data on just the radon levels in Canada, just because that is one thing that Alberta is missing compared to other provinces right now. We don't have a dedicated map of radon levels yet, but initiatives like the 100 Test Kit Challenge and library programs are going to sort of help us understand the radon landscape in the province. So hopefully that answered their questions.
Great. Okay. Well, so let's dig into that a little bit. So if a library was interested in starting a loan program, there are digital monitors that are available for use. And so you can provide support. As you mentioned, you do recommend starting in the fall. So it might be something that they want to talk about and look at starting in the fall of 2024. But they can have them just like maybe some other devices that they may have available in the library in plastic packages. And you've got resources already that you've kind of developed that from other programs that you can share with them.
Right. Yeah, exactly. So that's a good point. The kits that are in the library program are the continuous radon monitors. Every time we have a patron take them out for 3 weeks, they will pull that data and then we will reset the machine. So this way we aren't having a bunch of kits used for 3 weeks, which tends to be a little bit difficult to test for the library. So we use a continuous monitor. I'll put the email address into the chat for libraries that are interested or have more questions about the rental program.
Great, good. Yeah, and then we'll also email out a link that can also, or email out Jamie's email address as well. So there is, we talked about different types of tests. So this would be a one-use detector. It comes in a package, clear package. This is a different manufacturer, same idea. So they come in packages and really they're easy to use. So when people get them, they just cut open the package, take the detector out, and put it in place. So those are two different types of the one-use detectors, and they would leave those for 3 months. This is one of the digital monitors. And so as Jamie mentioned, every time somebody uses it, there is a reset button on the back that can be pushed. And so this gives a readout on the front about the radon levels and provides information about a 1 day, a 7 day, and then a long-term readout. And so really our recommendation is to loan those out as long as possible. So as Jamie said, usually they're 3-week or 4-week loan cycles, depending on the library. And they'll get a screening, so somebody can decide now if they want to follow up. I mentioned the mitigation grant program. And so if somebody wants to apply for the mitigation grant program, they do need to use one of the one-use detectors where it gets an official report. And so they may, use the screening from the library, and then they can follow up with purchasing a detector if they want to be able to apply for that. Yeah, good. Thanks so much for all that info, Jamie. Caitlin, another question we've been getting, and maybe we can do a little bit of discussion here, is about the just how do municipalities start? So let's start with kind of the obvious question. Why should a municipality think about providing radon information for their citizens? I know we talked about this in the presentation, but what are some of the reasons?
We know that for a municipality to take action on radon, that it can be a very daunting task to start on, especially if you're going on and you're looking at the Radon Action Guides that we've created for municipalities. They're really big. There's a lot of text, there's a lot of information. We know it can be really overwhelming, but Health Canada, Madison and myself specifically, we're here to really want to help you. We have found that grassroots action, so action that's happening on a local level, whether that's a municipality or a local advocate who is been personally impacted by radon, that is very passionate about spreading education and awareness, as well as helping their neighbors and community members take action on it. We've seen that type of grassroots action is the most impactful on making policy change, both at the municipal level and at the provincial level. We often, like I said earlier, we get asked that question is why Health Canada doesn't just, create a policy that requires everybody to do, to test their home or so on and so forth. And the policy levers actually exist only at the provincial and the municipal level. So that's why we created these documents, especially the two supporting documents, the justifications and policy rationale for radon action, and the radon action in municipal law, because municipalities do have the legal right to go in and create policies that impact their communities and the buildings that they're responsible for, as well as their citizens. And anytime that we're approached by a municipality, we just tell people start small. And starting small is something as easy as adding a page about radon onto your municipality's website. You can literally come on to canada.ca/radon and take all of our content verbatim and put it on your website. We would also be happy to provide you with images, whether that's from Take Action on Radon or from our own repository that you can share. The content's in both English and French. And then we've also created a checklist that you can go through your existing policy and see if there's been any action that's been made or been taken on radon within your community. And it gives you a bit of a jumping off point to start, and everything's hyperlinked to within the document. So then you can get more background information. You can learn what your legal justification is for you taking that action within your municipal powers and to create policy. And it gives you examples of what other municipalities in Canada or in the United States or internationally have done, so that you're not starting from scratch. So we often speak to municipalities who, like I said, they're super overwhelmed, but you can start small and you can make a lot of an impact a big impact by starting small. And whether that's a website or even reaching out to Health Canada and ordering education and awareness materials and placing them in your offices, creating social media posts. There's some really bite-sized actions that you can take that can have significant impact on your community and kind of get the ball rolling as you build your own radon action plan that suits your community as well as your resources that you have.
Great. Yeah. And we have found that with running the 100 Biscuit Challenge, the municipalities really are a source of trusted information for homeowners. And so, the federal government has a lot of resources that are easily accessible, but people go into their local office to find information. And so that's really helpful. Good. Yeah, thanks. And so we have, Caitlin does have a checklist. We will, again, in the follow-up email, provide links to those Radon Action Guides, as well as the Good. And then another question that we get is about the cost of radon mitigation. And so in Canada, we have done a survey through one of our programs with Take Action on the cost of mitigation that we're seeing across the country. And the radon mitigation systems typically cost around $3,000. And the complexity or the increase of the cost really depends on the complexity of the house where the system is being installed. So it may include, if a house has multiple footprints, a crawl space, or maybe more complicated architecture, it can add to the cost of the installation. But those are about the costs that we're seeing across the country. And as we said, there are local professionals that are available, so people can go onto that app, put in their postal code, and find somebody within a specific radius that they can call on to help. All right. Another couple questions that we're often seeing from communities are just about some of the responses for if they do provide homeowners with information, they feel like they have to be the experts for that information. And the good news is that you don't. There are lots of different resources available. So Health Canada, Alberta Lung Association, has contact information as well. And so when we do send out that email, we will share with you contact information. So as your citizens hear about radon, there certainly is some support to help you with answering questions. And really they can be some really tricky questions as people test their home and find out that they have high levels. They're starting to ask questions about their health and those sorts of things. And so those are really important things to be able to help resource, but you don't have to feel like you have to answer those complicated questions. Good. All right. We'll check in and see if there's more questions. Caitlin, do you have any other questions that we should be answering?
No, I just want to reiterate that, we are here to help you guys. If you really don't know where to start, but you want to start, just reach out to us. We're always happy to have a meeting. We're always happy to have a discussion and figure out how we can best support you in developing, taking radon action in your community.
Yeah, for sure. That's good. Another question that came in on the chat was about sharing the slides, and we can certainly do that as well. We'll put a link in that you can download the slides in the chat. Also, there is opportunity if you do want to have a radon session in your community. We can certainly help you with coordinating it, either through your library or through a town hall session. We can certainly help you with that as well. Good. Madison, how about you? Any other questions that you've been getting from communities?
Yeah, I'll just kind of echo what Caitlin said about we're here to help. And like Pam said, we're more than happy to do a presentation, and it doesn't have to be during the day. We're happy to do it during the evening or even on the weekends. We can come do a presentation so you can get more community members that attend. But yeah, we're just happy to help in any way we can, and all of the materials on our website too. We can help with those, or we can help get those to you as well.
Great, good. Thanks, Madison. Yeah, another question that we often get is about the different testing measurement levels. So I'm going to start a little bit backwards a bit. When we measure for radon, in Canada, we use becquerels per meter cubed. But there is often a transfer of information across the border. And so in the US, they use picocuries. So it's a totally different measurement. But the key thing is to note is that they're also, the numbers are really different. So in the US, the picocuries, their guideline is 4 picocuries. In Canada, our guideline is 200 becquerels. And so 200 becquerels in picocuries is about 5.4 picocuries. So you can see the difference. And we did actually have a homeowner one time. Actually, we've had a few homeowners call that have been really highly concerned because they tested and got a report back that said 50 becquerels, and they were looking at information telling them that it should be around 4 to 5 picocuries. And so you can see how that would be really confusing. So it is important to know that there is a difference between Canada and the US in the units. But there is also a difference in guidance. And so, Caitlin, there is a question in the chat about the different levels. So in the US, the guidance level is about equivalent to 148 becquerels. In Canada, it's 200 becquerels. And then the World Health Organization recommends that countries set a limit between 100 and 300. Do you want to just talk a little bit about Health Canada's?
Yeah, so often this question is a bit of a misnomer. A lot of individuals see the article that the WHO says that level should be at 100 becquerels, and it's actually the WHO and the ICRP, which is the International Commission on Radiological Protection. They support selecting a reference level between the range of 100 and 300 becquerels that is as low as reasonably achievable, taking prevailing economic and societal circumstances into account. So 200 becquerels is considered to be reasonably achievable in the Canadian context, taking into account the practicality of reduction technologies for the diverse geology and housing type that's found across Canada. So the WHO also recommends that countries with existing radon programs and well-established reference levels between the range of 100 and 300 becquerels should at first improve their acceptance rate for radon measurement and their remediation rate through better advice and support to homeowners. So all that's saying is when the WHO came out with this report recommending between 100 and 300, Health Canada had already adjusted our national or our Canadian guideline from 800 to 200 becquerels. So we took the advice of the WHO and we are working on improving our acceptance rate for radon measurement. So right now we're sitting at about 7% of homes have tested in Canada have tested their homes, as well as improving our remediation rate through advice and support to homeowners and tenants. And this, again, it loops back to the fact that the policy levers to actually take action on radon do exist at the provincial and territorial level. So Health Canada is able to provide education and awareness and support through grants and contributions and creating documents like the Radon Action Guides. But ultimately, we really need municipalities and provinces and territories to create radon policy that ultimately will take the decision out of Canadian homeowners and renters' hands, just like we saw what happened with smoking bylaws and regulations, so not allowing smoking indoors, and other health impacts that we've seen that are long-term threats to health that you don't see an immediate impact. So just like smoking, where if you're smoking, you may get lung cancer, but it will probably be in 20 to 30 years. With radon, if you're exposed to high levels of radon for a long period of time, you are increasing your risk of developing lung cancer. But it's a problem that, we talk to Canadians and they say, well, I don't think I have radon in my house. I doubt it will impact me. And we're we're more focused, we're following the recommendations of the WHO and being more focused on trying to actually create meaningful policy change and behavior change at different levels of government, as well as the behavioral change of Canadian citizens.
Right, so that's a good point. Often people think it's probably not in my home. I mean, there's a few different fears that we encounter. One is I probably don't have it. I haven't ever heard of anyone else having radon levels, so I probably don't. Do you, actually, Madison, do you want to answer that? Do you have a response for somebody that might not want to test because they haven't heard anyone else has it?
Yeah, so kind of like I mentioned during my presentation, any two houses that are even built side by side can have different levels of radon. So really the only way that you know what your level is in your own home is to test it. So with that being said, even though like maybe neighbors on both sides of you are low, you could still be high. And that's something, a risk that you can mitigate for yourself just by testing. And if it's low, then that's great. And if it's high, then there's action you can take to get it under that 200 becquerels per cubic meter.
Yeah, that's right. So yeah, testing and it's
Pam,
low is a good peace of mind.
Pam, I just also wanted to touch on the last half of Dorothy's question. So she said, we often get questions about action when you are within this threshold. And we often field calls from Canadians who maybe they've tested at like 204 or like 195, and they're wondering whether or not they should take action. And ultimately our message is there is no safe level of radon. It's all what you are comfortable with. So if somebody is in their home and they've tested around 200 and they're not sure whether they should take action, it is ultimately their own decision to make about what they feel comfortable for their personal safety.
Good. Another question we often get is whether new occupants should test. Should you test new homes, things like that. And so a new home that's just been built and occupants move in. Madison, you know, do you want to answer that question? Should the new occupant test for radon in a new house?
Yeah, for sure. So if you just purchased a house and you built it and it's new, you should definitely test for radon. That kind of gives you a baseline, you know what your radon level is pretty much right away from moving in, so you'll know. And then if it is high, then that means that you can take action sooner instead of maybe living in a house for 40 years and then discovering that it's high. So the sooner you find out, the better, because like Caitlin said, you can develop lung cancer if you're exposed to it for a long period of time. But if you're shortening the time that you're exposed, then that means that your overall radiation exposure is going down. So, yeah.
Yeah. And do you want to talk about the fact that testing radon levels, are they higher in new homes or older homes?
Yeah, for sure. So we have a new energy efficiency document that's come out. So they've done some research on it, and they're finding so in new homes, they're more energy efficient. So sometimes once the radon gets in, it's harder for it to get out. So you still should be testing in new homes and old homes, because again, we just encourage everyone to test their home no matter what. But they are finding that sometimes the radon levels can be higher in new homes because they're more energy efficient. So that might be another reason for you to want to test. So yeah.
And
Yeah,
I just want to jump in on that from a policy perspective for our municipal policymakers. You know, more and more people are being encouraged to make their home more energy efficient, which often involves things like upgrading your windows, sealing your home more, which creates more of a vacuum and can actually increase the radon risk in a home. So this is something to take into consideration in policies around healthy built environments, healthy community strategies, clean air bylaws, and any sort of climate change, climate action policy that's being developed, is that it is a risk that does need to be taken into consideration when you're developing these other policies, that it's still new, so it's often not taken into consideration. So as Madison had referenced, we did develop a radon and energy retrofit infographic. It is available on our resources document. It does link to and cite the research that was done in Canada specifically about this. So if you are interested, Pam will be sharing the link in the follow-up email for the resources documents.
Great, yeah. And so another related question with that, Madison, is about retesting. So if someone has tested their home once, should they consider retesting again in a few years?
Yeah, so with testing, we recommend to retest your home if you do any work to the building envelope. I think that's what it's called. I think I got that right. You guys, okay. Yeah, so if you could do any work to the building envelope, we do encourage to retest, because that can change things, like Caitlin just pointed out too. Doing these retrofits and making your home more energy efficient could increase the level of radon. So it's good to retest after that.
Great. Good. And we are seeing building code changes. So I mentioned that there is radon measures currently in the National Building Code. So many of our municipalities, especially the building officials, are aware of that, and they are enforcing those building codes. We do understand that there are new codes coming, so they're just in development, and they'll eventually be in public review. So there may be new measures also coming in the National Building Code in the next couple of years as well. Another question about testing municipal buildings. Madison, if so we've talked about testing in homes, and when you do test in home, really just one simple test is required. But if somebody wants to test in a workplace, do you want to talk a little bit about that?
Yeah, so in the resources that Pam will be sharing, we also, Health Canada has a testing in public buildings document, so you can look into that. Usually there are multiple tests that need to be done, and that's another thing too that you can talk with a measurement professional about, to find out all the exact information about how many tests you should use depending on your building, depending on building occupancy. So there's lots of different factors that go into that.
Yeah, great. And so, yeah, we will send out a link to the guide as well, and some support documents for testing in workplaces. But that is an area that can be addressed.
Yeah, and Kelly actually shared the link in the chat. Kelly's been sharing the links in the chat, so thanks, Kelly.
Yeah, yeah. And for sure, we'll send those out as well in follow-up email to, because we know that the chat doesn't stick around always. So we'll make sure that those are accessible. Great. Well, that brings us to the hour. So I want to make sure we're respectful of people's time as we come up close to the hour point. But I do just want to make sure that there's anything that we didn't address. Jamie, anything that you wanted to make sure we talked about today that we haven't talked about yet?
No, I think we definitely covered a lot today. Just, people like everyone has mentioned before, just should keep in mind that while we're cognizant of the fact that everyone is, busier, we're trying to do more with less, especially with the municipalities. There are tools available, there are resources available. So feel free to reach out, and we can always try to find a way to support each municipality the best we can.
Yeah, that's great. Thanks. Caitlin, anything that you wanted to make sure that you shared, message that you want to leave the municipalities with?
Just, being a broken record here, reach out to us, right? We know that taking action on radon is overwhelming and daunting. It fits in many, many, many different areas that municipalities, provide policy information and direction for their communities. You're not alone. These documents, they can be really overwhelming, but we really, not only are we here to help you, we want to help you. So even if it's something that you're not sure you want to go forward with, and you just want to have a bit of an exploratory meeting, reach out to us. We're happy to have an exploratory meeting with you. We're happy to brainstorm with you, and we're happy to help you as much as we can. So, we really want to see that more of that grassroots initiatives happening. It is how we do see the most amount of policy change and action happening, and it is the best way to protect Canadians from developing radon-induced lung cancer. There's nothing worse, as I'm sure all of the panelists on here can say. We've all worked a trade show where somebody far too young has come up to us and told us they have stage 4 lung cancer, and they tested their home and the level was really high, and they had no idea about radon, and they just wish that they had known, because now they're in a really tough spot. And it always breaks our heart every time we talk to somebody, because we're doing as much as we can to raise education and awareness, but we need help from all levels of government, from all people, to be able to spread the message, and also create the policy change that takes the decision out of the homeowners' hands, so that we are protecting them from radon-induced lung cancer.
Yeah, and certainly that's why I'm here. I kind of got drawn into radon, but then started to meet spouses who had either lost a spouse to lung cancer, or they had just been recently diagnosed, and they both trying to figure out why there was a lung cancer diagnosis with no smoking history. And really starting to hear some of those stories, and more we're hearing stories across the country too, of people who actually tested for radon and didn't do anything about it. And now, as they're facing a lung cancer diagnosis, just really struggling with regret. So lung cancer is the #1 preventable cancer. That's why we talk about smoking so much, is because we know we can prevent it with smoking. Radon is another way to prevent. So that's why we're here today. Madison, any last words from you?
Yeah, I think you guys have summed it up well. And even just personally for yourselves that are on this call, if your municipality isn't maybe ready to take that step yet, I think you can personally take that step and let your family and friends know about radon, let your neighbors know. Just try to spread more awareness so that people are aware of it and people can test. And November is Radon Action Month, so it's a great month to purchase a test kit and start a test kit. So yeah, and then I echo what everyone else has been saying.
Great. And thank you to all of you. We really appreciate you taking time out of your day to come and join us. And so keep in touch. We really appreciate your effort and your role in the citizens' lives. So thanks so much today. All right, take care. Bye.
All right, thanks everyone. Bye.